Hello everyone and welcome to today's lab video. So in this video today we're going to be going over all the bones of the skull. The skull is a very intricate structure. Tons and tons of bones make up the skull. So we break it up into the cranial bones and the facial bones. All these bones except for the jaw or the mandible are fused together by sutures. So it's not just one bone, it's all these different bones that come together to form the skull. We have a whole bunch of different holes or foramens in here, and meatises and fissures that then are important passageways for arteries, veins, and nerves. So they're looking at the fissures in the eye. We see two little foramens above and below the eye. So in this video, we're going to be going over all the major structures of the skull, all the major bones of the skull, and so forth. And these bones are important to know, especially the cranial bones, because then it helps you name the lobes of the brain as well. And if you remember the body regions, they come into play here as well. So starting with the cranial portion of the skull. So I have a whole bunch of orientations here, and this is what we'd be looking at in the laboratory if we were in the lab. But we got to make the most of what we have. So let's go right here. We can start naming some of these regions. So the first one here is the frontal bone. And then back here, there are two parietal bones. So frontal, parietal, and right here is an important suture. So where does this suture separate? It separates anterior versus posterior. So this is actually called coronal suture. There's also a suture that separates left and right parietal. So again, that's the parietal on that side, and that's a parietal on that side. Now, what's the section that separates left and right for the body? Sagittal. So this is the sagittal suture. So two important sutures right there. So frontal, parietal bones, so two important skull bones so far. And over here, I'll name using this one. So on the side here, it's hard to see on this angle right here, we have this bone right here. So right here would be the parietal, frontal right there. So right here, we have the temporal bone. Now there are a few different structures on the temporal bone as well. Right here is the zygomatic process. Over here is the mastoid process, which includes a structure called the mastoid air cells, and there's a sharp little spine down here as well that's called the styloid process. Now I'm not going to label all those, but mastoid process is an important attachment site for ligaments, styloid muscles and ligaments like the sternocleidomastoid. That's where it gets its name. And then styloid process is an important attachment site as well, and I'll show that as the video moves through a little more detail. I just want to name all the skull bones or cranial bones in this first one here, or try to name as many as I can based on these first couple of models. And then the other one here, right here is the one on the back of the skull. This is called the occipital bone. So occipital, there's different structures that we'll talk about on that one as well. But these are the main ones we can see around the outside of the skull. There are more in here that we're going to get to, though. Like you could see a little one out here as well, but we'll get to it when we get there. So I'm going to clear this for now and move on through the video and see what else we can find here. So here, starting at there's the frontal. So the region between the eyebrows right here is actually called the glabella. And there's a foramen right here. Foramen right there and a foramen right there. That's called the superior, above the orbit of the eye. So supraorbital foramen. There's another hole down here called the I think it's actually right there. The infraorbital foramen. So they're named based on where they are. So if we know the body markings and anatomical positions, this stuff kind of comes together a little bit. Playing through here now, let's see if we can find some other angles for some other important ones. So there is one right here, and we're going to highlight that coming up later. But that one, so that's one of the side processes of the sphenoid bone, and that's part of the greater wing of the sphenoid bone. So moving through here, you can, let's find a non-blurry part right here. So here, you can see, so this is the mastoid process. Just write mastoid, and then this is the styloid process. Two important parts that are both on the temporal bone right here. So this is the squamous region of the temporal bone. On the inside here, I'll talk about a petrous region. So the temporal bone is important because that's where your ear is. That's where your ear canal is. So you have your external acoustic meatus, I think I show an angle right here where we can see it. Oops, wrong way. So let's go back here. So right there would be the external acoustic meatus. So it's your ear canal, it's where your ear goes. Now, one thing I want to highlight on this picture here is the important parts of the back of the skull, or the occipital bone, and that's why I have this angle here. We're not on the facial bones yet, that's all up here. So we have all these little lines. So there's a superior and inferior nuchal line. I'm not going to label them, but right here is the superior and inferior nuchal lines, and there's a little protuberance or crest that goes down right here. So this is an external occipital crest, and right here, if you feel the back of your skull, this is called your occipital protuberance, a little bump back there. And these are also major attachment sites for ligaments and so forth. And on the base down here, we have these two little condyles. These are important. These are the occipital condyles. If you move your head like this right now, that's what is allowing you to say yes. And then the giant hole right here for your spinal cord is the foramen magnum. Where your spinal cord goes, very, very important one right there. But that's in the important parts of the occipital bone. So you have your, I don't think I labeled the suture back here as well. So we have the sagittal suture come back, and the suture that separates the occipital bone from the parietal bones is called the lambdoid suture. And sometimes you might find little sutural bones here as well, but those are different from person to person. And then there's the occipitomastoid suture, which is this connection right here between occipital, and it's connected to the temporal, but the mastoid process is close to that one as well. There are some other sutures, but we won't be naming every single one here. That will be, if we named everything, we'd be spending a lot of time just on the skull, even though we spent a lot of time to begin with. But now, moving forward, we can then look inside the cranial vault here. And this is where we get the posterior, anterior, and middle cranial fossa. So this takes off the cavera part, which is the big round part of the cranium, and we look at the little bases in here. So these little bases are where the brain sits, and they're like, I can't show the different levels, but there are three little levels right here. So these are called the fossa. But now what I wanted to highlight here are some other important bones of the cranium. So right here, we find one. It goes kind of like this. Remember I said that one had a greater wing? This is called the sphenoid. This is known as the keystone bone because pretty much every bone in the skull and face articulates with the sphenoid. So it's a keystone bone, also has a bat wing shape to it. Right here is the sella turcica portion of the sphenoid. So here I'll just write it, sella, I don't know if the captions will pick it up, turcica portion of the sphenoid, and right there is where the pituitary gland sits. There are also some important holes or foramens found in here, and we'll talk about here coming up. I just want to finish the labeling here. Then right here, this one is a new one. This is the ethmoid bone. This is both part of the facial bone and the cranial bones. But here is the cribriform plate. So these are all a bunch of little cribriform foraminas, which are a bunch of really, really tiny holes. And right here is where your olfactory bulb would sit for smell. Now there's a little ridge right here. This is called the crista galli. It's this little process that sticks up and actually sits right between your left and right hemispheres of your brain, and it literally like means rooster tip. So that separates each olfactory bulb and then sits right there separating the brain. So severe movements of the brain, that crista galli can actually affect that, and or even anything in the frontal lobe then. So right here would be the frontal bone. This is the tympanic bone. This is that petrous region of the temporal bone. Back here is the occipital, and then right over here is showing the parietal. So here, looking at this, you can see a whole bunch of different parts. Now, what I want to do is change this angle just a little bit. Let's go this way. I wanted to see all the foramens that we have in here. So I'm going to name all of these. These are all important. So in the sphenoid here, so this is sella turcica. Right here is the optic foramen. So where the optic, or the optic canal, not a foramen, is where the optic nerve goes. And then we can kind of have three in a line right here. So 1, 2, 3. This one is like an oval shape. It's called the foramen oval or ovale. So here, this one's the foramen rotundum. I'm not gonna write foramen. I'm gonna just write rotundum, just to save space and time. This one is then the oval, or ovale. And then this one is then the spinosum. So these ones are all important passageway for cranial nerves, arteries, veins, and so forth. So when we get to the sections on all the cranial nerves, these ones will come back up in conversation. And then there's one on the inside here, a label over here. This is the lacerum, a foramen, but it's just a lacerum. Then this one I already labeled before, the foramen magnum. And then there's a little one right there on each side. This one is part of the temporal bone in the ear area. This is the internal acoustic meatus. So internal acoustic meatus. And then the last one right here is one of these on each side. This one is the jugular foramen. So guess what goes through there? The jugular vein. So that one's pretty easy one. And there's also a little canal down here. It's hard to see, but it's the hypoglossal canal. Don't worry about that one. But here you can also see the different wings on the sphenoid. So there would be the greater wing of the sphenoid coming off there. There are some lesser wings of the sphenoid right here. So there, lesser wings, greater wings. And so the sphenoid looks like a bat if you draw it out at the right angle as well. But you might not be able to see it right here. But these are the important parts in the floor of the cranial vault. All these different, think of everything that needs to feed into the brain and come out of the brain and so forth. All right, so I'm going to clear this now, and then we're going to move through and just make sure I got everything here. Let's go actually to, I think I got everything I need to say on the base of the skull. Occipital condyles. Now, again, I haven't named every single thing, so just know that there's more. This is just kind of like the superficial level of naming everything in the brain. So the important parts, at least for our cases for anatomy and physiology 1. Now, of course, there'll be more detailed stuff if you take other advanced anatomy and physiology classes. You'll learn more about all the different importances of all of these. So here you see where those foramens come through this side as well. So now we are going to move more into the facial bones. So the first one I want to start with here is just the mandible, which is the jaw. So let's start with, I'm sorry for jumping around right here. So there, I'm showing the jaw a little bit, or the mandible. So the mandible has a few important parts. There's a little hole on the inside here. So again, this is the mandible. There's a little groove right here for the passageway. This is the mandibular foramen. Up here is the temporal mandibular joint, or this is known as the TMJ. There's a little notch right here. It's called the mandibular notch. And then, so this is then the mandibular fossa so this connects to the temporal bone, and that's what forms your, mandibular joint right there. This is then the mandibular angle, and this is mandibular ramus right here. Ramus is an arm-like projection, and so forth. Now let's change the angle and look at the anterior side right here. So right here is what I want to highlight. So right here is then the ramus. This is the angle. So this ramus is the arm-like projection right there. Then right here, this is the mental region. So this is the mental foramen. And then right here, the teeth are sitting in all these alveolar processes as well, so they get a name too. So the next two bones we have on the facial bones here are the maxilla. These are the maxilla bones. And then within this, we also have the alveolar processes as well for the teeth. So there's a left and right version. There's a zygomatic process here, and then there's also a process that comes up here. So this forms a lot of different sutures with different bones. From the other maxilla bone, this is the nasal bone, lacrimal bone, zygomatic bone, which is your cheekbone, and so forth. So I didn't name that one yet. So right here, this one is the zygomatic. So zygomatic bone. Right here, we have the nasal bone. Might as well name it since we're here. The maxilla. Let me just make sure I'm getting them all. So maxilla, We have the mandible, the zygomatic, so left and right zygomatic, a left and right nasal. Now, deep in the nose here, let's see if we can get in there too. This plow-like bone separates left and right nose is the nasal. No, this is the vomer. This one's the vomer. I was saying the nasal septum, but the bone is called the vomer. And then up here is a perpendicular plate of the ethmoid bone. In here then, so that's part of the ethmoid bone deep in there. Right here is then so we have these different grooves, so these little outcroppings here are little grooves in the nasal cavity. Purpose is to help humidify and warm the air as we breathe it in so we can get adequate gas exchange. So this bone down here is showing it's fused here, but this is the inferior nasal concha. So there's a left and right one of these as well. Now there's not a left and right ethmoid, it's just it's an ethmoid mass. So there's a perpendicular side mass and then a left perpendicular mass and a right perpendicular mass. So you breathe the air in, it goes in and goes back. Now on the side of the orbit here, you can't really see it, but it is right here. That's called the lacrimal. So the lacrimal bone, there's a little lacrimal fossa there, so if your tears are being formed coming down over your eyes, and that's how they then drain, the tears then drain out through your nose or go back into your nasal cavity. So since this is getting messy, I'm going to clear this as we move through here. We haven't named them all, so there you can get a better angle of that lacrimal bone. Right there is actually the side of the ethmoid bone. Right here is zygomatic. Right here is the sphenoid. Now there's two fissures right here. So there is the inferior orbital fissure. There's a superior, no, that's a superior, got ahead of myself, superior orbital fissure. This one is in the inferior orbital fissure. And then right there is the optic canal. So lots of stuff happening in the eye orbit. And I always say, if you can name everything going on here in the orbit, you're doing a good job studying. So that's all part of the sphenoid right there as well. So then moving through here, I know this is going on a while, but there's a lot to label and name on the skull. We haven't gotten to the hard palate yet, and that's where I want to come back to this one, because there's an important bone back here we have yet to name. So the anterior portion of the hard palate is part of the maxilla, so you have the left and right maxilla right there. And now there's a posterior portion as well, and it's this intricate bone right here. So this is the horizontal part, and then it has a little vertical part right here as well on each side. This is called the palatine bone. So palatine. Now there is a little tiny pit that goes back into the orbit of the eye, so it's considered part of the eye orbit too. So this is the palatine bone. There's a horizontal part, which is the back part of the hard palate, or the posterior part of the hard palate. So it's not completely all maxilla in the hard palate. And then this is the perpendicular part, which forms the back parts of the nasal cavity. And then the very, very posterior parts of the nasal cavity is actually formed by the pterygoid processes here on the sphenoid. So this is part of the sphenoid right here. So the sphenoid goes up through here and like that. Oops, I might have drawn that a little bad, but these are called the pterygoid processes, which form the most posterior parts of the nasal cavity. But here, the perpendicular plates of the palatine bone are also an important part as well. Let's see here. Did I get everything in my notes? I think so. I don't think I missed one. I got the important processes, the important foramens, named all the bones, all the different processes. Yeah, I know. So looking at these models are much better than looking at 2D figures. But yeah, I think we got them all. So here, I'll just play this video through so that you can see it going through smoothly without me jumping around. So just showing here the anterior portion of the face, all the different facial bones. Now, it's nice here because the sutures on these skulls that we have in the laboratory are outlined in orange. Note that if you are looking at an actual skull, it's not going to have this nice, pretty outline on it for all the sutures. You have to be able to identify them. But if anything I use on the practical would come from these skulls right here. So if you understand these models, you should be good to go. The sphenoid is one of my favorite bones because everything just fuses to it, has all these foramen in it. It's such an intricate bone. If you understand the sphenoid, everything else kind of fuses to it. It's the keystone of understanding the skull bones. So the skull bones are the most difficult bones to understand in the body. In the next video, we're going to be going through all the different bones of the spine, all the different vertebrae, and so forth, the different structures of each one. Because remember, they start right here. So this is the occipital condyles, and that articulates with C1, which is the atlas vertebrae. And as you're watching this, you're probably saying, yes, this is exciting. And when you say, yes, this is exciting, you're using your occipital condyles, which are articulating with your atlas. So Atlas is the Greek god that holds everything up. But we'll get more into that next video. So that's all I have for today. Sorry, this one dragged on a little bit longer than I planned, but there are a lot of bones and a lot of holes to label. So if you have any questions, feel free to reach out to me. But if not, I hope you all have a great day, and bye-bye.